Senator Merkley, welcome back to the show, sir.
Thank you so much, Chuck. Good to be with you.
Let me just start with this question. The timing of this announcement. You have a Republican Party that is still looking to repeal Obamacare. The possibility that they do that is still there for the next couple of weeks. Why muddy up this issue? Why spend so much time working on a new health care plan when the Democratic Party took so many bullets for fighting for Obamacare, and you've still been fighting for it, and it's still the law of the land?
Well, in the course of arguing over Trump wealth care, I might add, we talked to our citizens across the country. I had 36 town halls in Oregon, mostly in Republican counties, 2/3 of them. And what those citizens in Republican counties came out and said is our health care system is just too complicated, too inefficient, and too stressful. And there was real desire, and I'm talking Republican counties, for a simple, seamless health care that just by virtue of being an American, you have coverage when you need it.
Look, it sounds great. Everybody wants this until you tell them they're going to have their taxes raised in order to pay for it. That's number one. But again, I go back to Obamacare. Is this your way of saying Obamacare is a failure?
No, this is our way of saying that in the course of defending Obamacare, because it was such a leap forward, we're also very aware of how stressful health care remains. And if you talk to citizens, blue-collar citizens, look, they're going, hey, am I eligible for Medicaid in Oregon? That is the Oregon Health Plan. But if I earn a little bit more, now I have to get off that plan. I have to go to an exchange. And on that exchange, can I do that in the middle of the year? What if I have a new employer that only covers me and not my children? Can I get my children onto the CHIP program, Children's Health Insurance Program? It's just a gauntlet of paperwork and complexity that no other developed citizens and no other developed nation face and shouldn't have to face here. And it's cheaper. It's cheaper for our nation. Think about the fact that Medicare,
let me ask you this. You say it's cheaper for the nation, but whether you use the Sanders estimate of $14 trillion over 10 years, an additional $1.4 trillion in the federal spending, and that's one estimate. Another puts it twice that a year, $3 trillion a year. Where do you get this money?
Because the same estimates say that the total spending by our citizenry on federal budget and off federal budget put together, because that's the total cost to our society, goes down. And you can imagine why. Medicare has an overhead of about 3%. Private insurance has 25 to 30% that's wasted. Private insurance denies your claims even when they should cover what you have. So every time you are sick or you do have an accident or a member of your family, you have to go to war and just in order to get the bill paid. That's an additional piece of the stress. So having a system that is cheaper for the United States of America, that provides better coverage than our current system, that gives peace of mind instead of the stress that we have now, that's appealing to Democrats and Republicans.
I understand with the way you're painting it, but I'll be honest, Senator Merkley, it sounds a little too rosy. You know, why was Chuck Schumer wrong then in 2009 when he said Medicare for all would bankrupt the country?
Well, Chuck Schumer also sponsored single payer when he was a House member, but what he was looking at was commenting on just the federal cost if you put more weight there. But there are ways to approach Medicare for all that don't cost another single penny to the federal government. I've been arguing that we need to do a public option. Start with a public option. People are already paying money on the exchange. They already have tax credits on the exchange. Being able to buy into Medicare on the exchange doesn't cost a penny. In fact, it will save money because it's a more effective, efficient system. Enabling private companies to be able to buy into Medicare doesn't spend a dime. They're already spending healthcare dollars. They'd still be footing the bill. So there are ways to proceed forward that would not cost the federal government anything, would take us much closer. And in the course of it, the entire cost to our society keeps dropping. We have an unsustainable system.
Right. So, Senator,
we have to have a serious conversation about that.
Your last comment seemed to think is, what you're saying is you're endorsing the idea of Medicare for all, but that isn't really what you just described is, well, we need to have an incremental step, fix Obamacare, add a public option. That's a different plan than this one. So which are you pushing for?
No, Bernie's bill also has an incremental approach. It lowers the age in year after year after year. So it is not saying it's a dramatic change all at once. But so I don't think anybody in this conversation thinks you can take the enormous 1/6, 1/5 of our economy and change the whole way it's constructed. But giving people voluntary ways, and by the way, under Bernie's bill, it is voluntary for people to opt in. You lower the age, you give voluntary opportunity to opt in. Listen, this conversation is so important to the future of the nation. We have the most fractured, stressful system in the developed world. We have the most expensive per person system in the developed world. We have the most expensive system per treatment in the developed world. We have to talk about doing better, and citizens want simplicity, they want seamlessness, they want stress-free. Let's have a serious conversation about it.
I hear you on all that, but it sounds like you're promising the world. And it feels like I'm having a deja vu when Republicans essentially spent 8 years over-promising and under-delivering, and their voters have now punished them for it. Their voters turned to a guy that had no experience ever running for political office to be their nominee because they were tired of broken promises to the base. How does this not end up as a broken promise, pie in the sky, over-promise, under-deliver?
Well, I can certainly contest your theory there, because they turned to someone who promised the world and had no plan to back it up and hasn't delivered on any of he's broken every single promise. Remember, this was the man, Trump, who was going to promise your health care will cover everyone. Your health care will cost less. Your health care will be of higher quality. And then
how are you guaranteeing? This is not about Donald Trump, though. My point was the Republican Party went down this road, over-promising, not delivering. This feels like something there is no pathway to pass it. Are you not raising expectations only to essentially bring back the cynicism that politicians just love to tell you everything is easy, we're going to make the system simple, and then you can't get it done?
It would be over-promising to say this bill is going to pass this year, that it's going to get a hearing. But to lay it out as a vision, as this honestly has been laid out, to say that we need to have discussions across America about how to make our health care better, and that's the way Bernie presented it today. This is important to our country, to wrestle with how we have a simply better system than we have at the moment. So those who say never talk about a vision of where we could go to because you can't get there tomorrow, I would say we'd never have any progress. And that would be a huge mistake.
Well, Senator Merkley, I love the idea of more debate, and you're absolutely right on that, and that's a good thing to have. Sir, thanks for coming on, sharing your views. Always a pleasure.
Good to be with you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.